Hello everyone, welcome to my channel Nurse Educator. In today's video, let us discuss about bone marrow aspiration and biopsy. Let's start the video. What is bone marrow? Bone marrow is the soft, spongy center part of the bone. Here, the bone cells are produced in the bone marrow, such as red blood cells, white blood cells, and platelets. Okay, what is bone marrow aspiration and biopsy? Okay, these two are the invasive procedures where small quantity of bone marrow is obtained from various sides of the bone. What happens in bone marrow aspiration? In bone marrow aspiration, a sample of fluid with bone marrow cells is taken. Okay, and in bone marrow biopsy, a small sample of solid bone core is removed. Okay, here no fluid content is removed in biopsy, but in aspiration we'll remove the fluid content. Okay, then we'll see what are the indications of bone marrow biopsy. Okay, to diagnose blood cancer. Okay, blood cancer here, to know the stages of cancer, how the cancer is progressing in the patient. Okay, how it is growing in the bone marrow. For example, in case of metastatic or secondary cancer, okay, where the cancer will start elsewhere in the body, for example breast cancer or lung cancer. Here this cancer can spread to secondary location like your bone marrow. Okay, with that there are some other cancers such as leukemia, lymphoma, multiple myeloma. Okay, multiple myeloma is a rare blood cancer that harms your plasma cells. Then to monitor treatment progression. Okay, to monitor treatment progression, if the patient is receiving cancer treatment, okay, in those scenario or in those conditions, the doctor will suggest to take the regular bone marrow biopsies. Okay, to diagnose blood disorders. Okay, blood disorders such as leukopenia, thrombocytopenia. Okay, then to identify various type of anemia like aplastic anemia. Aplastic anemia, this is a type of anemia where the blood bone marrow cannot produce enough blood cells. Okay, blood cells such as red blood cells, white blood cells, and platelets. Okay, to diagnose myelofibroma and myelodysplastic syndrome. Okay, what is myelofibroma? Myelofibroma is a condition involving fibrous scar tissue is replaced by bone marrow, and myelodysplastic syndrome is a bone marrow disorder in which stem cells does not mature properly. Okay, prior to bone marrow transplant. Okay, before bone marrow transplant also bone marrow biopsy is been done. Why? To know a good match for a allogenic stem cell transplant. Okay, to receive, before receiving or donating the healthy stem cells, they are recommending bone marrow biopsy. Okay, then to detect abnormalities in genetic and vitamin deficiencies. Okay, genetic defects, for in case of myeloma. Okay, in multiple myeloma what happens? Here we see there is a genetical changes in the patient. Okay, so to know that genetic cases, so the blood samples or the bone marrow biopsy or samples are undergoing several tests. In those tests, we'll also conduct the genetic test, that is fish, fluorescent in situ hybridization. Okay, by this what are the genetic changes, how the mutations has been happened in the DNA, that they are going to study in this genetic abnormalities, and also in the vitamin deficiency they are going to know. Okay, then we'll see what is the insertion site of the needle. Okay, the first site is posterior superior iliac crest. Okay, it is also known as PSIC, It is the most commonly used site. Okay, the position is lateral decubitus position. Okay, as you can see in the picture, it is in the lateral position. The second position insertion site is anterior superior iliac crest, that is ASIC. It is done in the prone position. Okay, prone position in the sense lying on the abdomen with the help support of pillows. Okay, under the face, abdominal region, and at the legs. Okay, then the third site is sternum or breastbone. Okay, here in the sternum bone, about 1 centimeter above the sternomandibular angle to 1 centimeter of the midline. Okay, in that angle where you can see in the picture, there the bone marrow sample is being taken. Position is supine position. Okay, you can sleep straight how you are sleeping on your bed. Okay, it is the most common site for adults. Okay, this site should be avoided in infants. In infants, you should not select this site. Okay, what is the most common complication in sternal insertion site or needle aspiration? Here, accidentally puncture can happen to lungs because lungs are nearby structures, so there might be chances of puncturing the lungs. Okay, the next insertion site is medial aspect of tibia. Okay, just below the tibial tuberosity we can insert the site, as you can see in the pictures near the tibial tuberosity how you can insert the needles. Okay, the most common site in infants and 2-year children. Okay, this site is usually preferred for infants 1 year old or less than 1 year and 2 years of age children. Okay, the fifth site is spinous process of vertebrae. In the vertebral column also they are going to collect the samples. With that, some other sites such as scapula, cranium, ribs, and long bones. Which type of needles are used in bone marrow biopsy? Okay, there are 4 types of needles. In these, any one can be used. Okay, the most commonly used needle is Jamshedi needle. Okay, it is most commonly used in all hospitals. Okay, Siles bone marrow biopsy needle and Klima sternal needle and Fatherfield iliac crest bone needle. Okay, these are the other needles also been used in some hospitals. Then we'll see what is the procedure of the bone marrow aspiration and biopsy. Okay, so before starting the procedure, we should explain the procedure to the patient. Okay, a mild sedative will be given 1 hour before the test. Okay, the sedation is been selected. Okay, the sedation will have 3 types of sedations. The first is lidocaine. Lidocaine, in this the patients numb the skin. Okay, the area where we are using the lidocaine, only that area is been not having the sensations, and the patient will be awake in this procedure. Okay, the second anesthesia or sedative we are using, that is anxiolytic. Here anxiolytic is being used to relieve the anxiety. Okay, in this case also the patient is being awake. And the third is the full sedation. Okay, full sedation where the patient's relaxes. This sedation will relaxes the patient and blocks the pain. Here the patient will be asleep, he is not awake. Okay, so prior to full sedation, the doctor will suggest first of all he will select the site. After select the sedative type. Okay, after selecting that, your procedure is going to be started. Okay, if you are having full sedation, you have to be nil per oral prior to the prior 1 day. Okay, before the biopsy. Okay, then if you are choosing lidocaine, okay, so a mild sedative will be given 1 hour before the test. Okay, further tell the patient the test usually takes only 5 to 10 minutes, and then more than 1 biopsy samples may be required. Okay, here more samples can be required, and this test only needs 5 to 10 minutes to finish. Let him know a blood sample will be collected before the biopsy for laboratory testing. Okay, a blood sample should be taken from the patient within 48 hours before the procedure. Okay, which type of blood test they will do? Here they will do the CBC, that is complete blood count, PT and PTT, prothrombin time and partial prothrombin time. Okay, make sure the patient has signed a consent form. Check the patient for hypersensitive to the local anesthesia. Okay, before giving the anesthesia, a test dose should be given to know that if the patient is having any hypersensitive reaction. Okay, after confirming with the doctor, tell the patient with bone like which position should be selected. Okay, like sternum or anterior or posterior crest, vertebral spine, processes, ribs or tibia should be used for the site. Okay, then we'll see the first biopsy procedure, that is aspiration. Okay, biopsy aspiration. How the doctor is going to do the biopsy aspiration? The doctor prepares the biopsy site and injects a local anesthesia. He then inserts the needle through the skin. Okay, here the needle is being inserted through the skin, the subcutaneous tissues and the cortex of the bone. Okay, while the doctor removes the stellate. Okay, when the cortex of the bone is being touched, so what happened? The doctor will remove the stellate from the needle and attaches a 10 to 20 ml syringe. Okay, now after that he starts the aspiration, that is 0.2 to 0.5 ml of marrow, and withdraws the needle. Okay, the pressure is applied at the site for 5 minutes while the bone marrow slides is being prepared. Okay, after removing the needle, here pressure should be given to the patient for 5 minutes so that they should not be bleeding. Okay, if the patient has thrombocytopenia where platelet counts are very less, so it is common that he will have more bleeding. Okay, so to prevent that blood back flow of blood, so here the pressure should be given for 10 to 15 minutes. Next procedure. Okay, the next point is the biopsy site is cleaned again. Okay, after pressure again the site is being cleaned and a sterile adhesive bandage is applied. Okay, adhesive bandage should be applied at that position. If the doctor doesn't obtain any adequate bone marrow specimens on the first attempt, okay, if the doctor is not able to collect the samples, so what he will do? He will reinsert it in another site within the anesthetized area. Okay, wherever he has given the anesthesia, he will try to collect the sample again. If the second attempt also fails, a needle biopsy may be necessary. Okay, if the this aspiration biopsy is being failed in second attempt also, so at that time he will continue with, or he will start the biopsy procedure. We will see next, that is needle biopsy. Okay, after preparing the biopsy site, now again biopsy site is prepared. Drape the patient in the sense, cover the patient. After examiner marks the skin at the site with an pencil or pen. Okay, with a pen or pencil, the doctor should mark the site where he is going to insert the needle. A local anesthesia is then injected intradermally or subcutaneously at the bone's surface. The biopsy needle is inserted into the periosteum. Okay, here the biopsy needle will be inserted in the periosteum. Okay, the outer covering of the bone. Okay, and the needle guard is set as indicated. The needle guard is set as indicated. The needle is advanced with a steady boring motion until the outer needle passes through the bone's cortex. Okay, here which type of needle we are using? The most commonly used needle is Jamshedi needle. Okay, so what is the doctor doing here? He is trying to insert the needle into periosteum. Okay, while inserting in the periosteum, he is using an boring motion in the sense he will rotate it, not fully, he will rotate it in the 180-degree angle. Okay, 180-degree angle. The inner needle with trephine tip is inserted into the outer needle. Okay, after that they are removing the placed needle and they are using an trephine cover capping of the needle by alternatively rotating the inner needle clockwise and counterclockwise. Okay, I have told 180-degree, so he's rotating the needle one time clockwise and again he's making it back, that is counterclockwise. Okay, the examiner directs the needle into the marrow cavity and then removes a tissue plug. Okay, what he will do, he will try to remove a tissue plug by doing this motion. Okay, during this motion the bone marrow tissue is being accumulated in that needle. The needle assembly is withdrawn and the bone marrow is expelled into a labeled bottle containing Zenker's acetic acid solution. Okay, here the sample is being labeled in the container called as Zenker's acetic acid solution. After the biopsy site is cleaned, a sterile adhesive bandage or a pressure dressing is applied. Okay, bandage and pressure should be applied at the site of biopsy. What are the complications of bone marrow aspiration or biopsy? Here we will see the patient will have hemorrhage and infection at the site of biopsy. Okay, why hemorrhage and biopsy? Because some might be taking aspirin tablets or some might have thrombocytopenia. Okay, in those conditions the bleeding, because the aspirin is in blood thinner, okay, it might happen that the patient will have more bleeding. Okay, and also the second complication is puncture of the mediastinum. If the doctor is choosing the sternal bone, so there might have been chances for puncture to nearby adjacent structures. Okay, then what are the precautions to know the bone marrow biopsy? It is contraindicated in the patients with severe bleeding disorders. Okay, if the patient is having a severe bleeding disorder, so he is in a continuously taking the medications of blood thinners, so in those conditions we should avoid this biopsy or aspiration. Send the tissue samples or slide to the laboratory immediately. Okay, after collecting the samples, immediately the the bone marrow sample should be sent to laboratory. Okay, and after the procedure the patient can go home. If he is under anxiolytic or full sedation, there should be a other person who can drive him to his home and he can eat light meals, and there are no other precautions required regarding this procedure. Okay, so thanks for watching the video. Please like, subscribe and share my channel.